Bladder cancer has traditionally been linked to smoking, but what's interesting is that even as smoking rates have declined nationally and globally, bladder cancer numbers haven't decreased as much as we would expect. In Ohio, where most of our patients reside, the incidence of bladder cancer across the state has not budged over the last 30 years. That suggests other factors, especially occupational and environmental exposures, may be playing a larger role. In this study, we used highly detailed geographic data to estimate air pollution exposure at the level of small residential areas called U.S. Census blocks. Think of an area in which about 100 people live. That's the level of data that we have. And we linked that data to patients with bladder cancer and a matched non-cancer population. We found that, especially after adjusting for key patient factors, it's not just one chemical, but patterns of environmental exposures that are associated with bladder cancer risk. These patterns consistently include industrial and combustion-related pollutants, which the EPA designates as harmful. Importantly, many of these signals were still present in people who never smoked, suggesting that environmental exposures independently contribute to bladder cancer risk. Did we expect these pollutants in our analysis, and are they linked to other cancers? This is a great question, and some of the findings were expected and some were surprising. We did see several known or suspected bladder cancer carcinogens. These include nitrosamines, trichloroethylene, aromatic amines, and aldehydes like formaldehyde and acetaldehyde. These are well established in the literature. For example, nitrosamines and aromatic amines have long been linked to bladder cancer. Trichloroethylene, or TCE, has been associated with kidney cancer and some other malignancies. And formaldehyde has also been linked to a number of other malignancies, including leukemia. So in many ways, seeing these compounds emerge from our study strengthens confidence in the results because we're seeing signals that are biologically plausible and have been proven elsewhere. But we're using a new population-level approach to demonstrate these exposures increase risk for bladder cancer. What was more unexpected and interesting is that these pollutants appeared together as part of broader exposure patterns. So rather than acting in isolation, and this makes sense because people aren't exposed to pollution as single chemicals, but rather a mixture of chemicals in different patterns and concentrations. What are the sources and how can exposure be reduced? So these pollutants largely come from a few major sources. The common threads are vehicle emissions, industrial processes like plastics and chemical production, combustion sources, and urban infrastructure like airports or construction activity. So these exposures, they're often tied to where people live, people work, and the broader environmental conditions in a particular geographic area. In terms of prevention or mitigation, there are two levels. At the level of the individual, individuals can avoid areas of heavy traffic exposure, and they should be aware of occupational exposures and use the appropriate protective equipment. From a policy and public health strategy standpoint, this information should inform emissions, transitioning to cleaner energy sources, and urban planning to reduce the proximity of where people live in terms of being close to high emission sources like steel mills and other heavy industry. I want to know that there's still so much we do not know about this area, and we need larger and broader studies to further evaluate how exposures influence cancer risk, both at the individual and the population level. Overall, our findings suggest that bladder cancer risk may be influenced by real-world environmental exposure in the form of air pollution, particularly the industrial and combustion pollutants. This highlights an important opportunity to better understand and potentially reduce environmentally driven bladder cancer risk. And these findings may also have implications for other cancers as well.